Hey, everybody. Welcome to this week's segment of human behavior and the social environment. I'm just getting your most recent Ashford chapter open because we were kind of cruising through it. Like the psychological dimension, if I remember to it, there's no glare this way, so we're going to go from this way, if that can work. It is a good amount of psychological dimension. You can use some of these for your final paper and your final presentation. You're filming online. If you have trouble filming it, again, come in person into the classroom just so we can get you filmed. We define grit, and that will be a lot of us in here, keeping the struggle alive till you finish this degree, no matter what, finish your bachelor's degree. Apply for every scholarship that you can and keep doing everything. Marriage, hello, how are you? How's it going? Good. Are you presenting today too? You have your presentation? No? Okay. Were you going to film yours online or come in person, do you think? Film it? Okay. What was yours on? I'm like totally blanking. I'm forgetting them all.
Eating disorder?
Okay, like anorexia and bulimia and all that. Cool. All right, I was just finishing up like chapters 8 and 9 today. About now we're at like marriage and family. So this is like right after college and adulthood. So we did adulthood the past 2 weeks, and now we're doing either the end of college or right after you finish and graduate and try to get a job, become self-supporting. So the book has it to where it's like marriage is still around. People still get married. But it says a lot of people are now like cohabitating, kind of like living together because it's easier, it's cheaper. You don't have to have a ceremony in the pandemic. More people are single today because of higher divorce rates. So the divorce rate's at like 55%. And then if I remember, the other book said second marriages divorce rates a little higher, like 60, and then third marriages sometimes even higher than that, like 70% divorce. So adjusting the marriage, overcoming some of the myths, people prepare, enrich inventory. I actually tell a lot of people, if you're like dating someone, there's 100 questions before you say I do. There's a few other websites that have good questions, but this one here, it says the prepare and enrich inventory is 80% accurate for couples if they're satisfied in their marriages, and it looks at 4 spots: the personality, then the intrapersonal, interpersonal, and then external, maybe like family relations and things like that. The single part, remaining or becoming single, there's an increase dramatically over the past 25 years. So it's about 1996. More people are single and just choose not to get married because there's not as much a stigma like living together, moving in, or single altogether. So, and it says if you just stay single your whole life, there is research on this that overall we could be less happy than married people, and especially men. A lot of times they say because men are very dependent on women in some way, so that's where their unhappiness and stress could be. It says lack companionship and socializing opportunities. Although last class I was kind of covering that you actually could join a church or spiritual community of your liking. That does give the companionship. Nowadays, we have a lot of online communities like Facebook and Instagram even. And then it says a good network of friends can eliminate these concerns. So if you get into a good spiritual community, maybe even volunteering, that can go away. The last half of the slide is gay relationships. That's about 10% for both sexes, like approximately 10% of the population is gay. Aspects of intimacy they value are similar to heterosexual relationships. They may not get the same recognition as a real commitment, but this book was written in like 2012, so the Supreme Court passed the law that gay marriages are legal as of 2015, and they still can get now benefits and insurance and all that. And his last slide part is homophobia and internalized homophobia is still an issue. And with the social dimension, say transition to parenthood, the top three stressors are money. That's like why a lot of places divorce, people divorce. Children behavior, so like if you don't get a handle on that and or get them to like a psychologist to help with it, that could be one of the major stressors. And the third is what's called insufficient couple time. So if you're always working and then you're always taking care of the kids, then the only sufficient couple time is maybe at night right before you go to bed. Second part here says children of gay parents are similar to heterosexual parents, and then there's increased number of couples are childless. So now there are 10% of women choose not to have children. Also, our infertility rate has gone up, so about 10 to 20% of the couples are unable to become pregnant after a year of trying. So adoption is a big opportunity now. So a lot of people either do foster care adoption or foster to adopt. And miscarriage sometimes is an experience those that have infertility may experience, unless if it's from the man's side of the fertility. Now, social dimension in that later adulthood. So after you're finishing college, the work life, it's a significant part of your identity. So here we all identify as a social worker. If you get a license, you can get a job and call yourself a social worker. Balance between leisure and family is a challenge at this stage. So it's hard to have time with your husband or wife. And it's also hard to do any leisure time because you're still trying to see family. Many jobs are still gender oriented, it says. Like for a while, I've been one of the only men in social work. Most of my colleagues have been women, but that's changing a little bit. Did you want to go on and do license practice and all that too? Masters? Okay. What practice area were you interested in? I always forget. I always like to ask. Foster care. That's a good one too. People done presentations on that, foster care and adoption for the final presentation or the final paper. But any questions about this stuff so far? I know it's kind of self-explanatory. So this is where I left off the other day, and this is all the multicultural considerations. So the author of this book starts with Native Americans. He says their unique problems stem from a history of discrimination, broken treaties, and prejudice. There's poor academic attainment. Only about 57% are high school grads, and extremely high unemployment rates. Language problems have affected progress, and stereotypes promoted by TV and movies, which we're trying to get away from. With like they even changed the Washington Redskins football team name to like the Washington football team. The second one they have is African Americans. Dialect differences have challenged them, the author says. The stereotype is of the violent black is influencing their social progress. Poor academic progress and lack of social progress. Social conditions are that are determined to self-improvement, like discrimination. Social conditions that are detrimental to self-improvement, like discrimination, racism, and lack of opportunities. The next one is Asian Americans, multicultural consideration. The author gives you that language problems have been a challenge. The model minority stereotype with acculturation, family roles and expectations can conflict with the white American culture. Value changes in family relationships can lead to a schism between younger and older generations. Last one here is Hispanic Americans. Language problems are critical because many Hispanics speak only Spanish. Poor academic progress and lack of social progress, improvement in middle paying and high paying jobs, lack of appropriate skills for coping in the dominant white society, and discrimination and prejudice there too. And then the last social part is blending of religion. So more people are coupling with someone of a different religion. So in the past, you used to only marry, like, a Christian marries a Christian, a Muslim marries a Muslim, a Hindu marries a Hindu, and an atheist marries an atheist. More nowadays, just like a lot of those things in the previous slides are changing, there are also more people blending religions and recognizing their similarities instead of their differences. Some gender considerations. So to be a successful woman, marriage and motherhood used to be a big piece, and that's also shifting to where now you can get a job out of college and be self-supporting and not have to focus on that. It says husbands have increased participation in housework over the years, but still only 1/3 of what their full-time working wives do. What do you think about that last statement? Like maybe with family or friends that you've seen, men kind of help with cleaning and dishes and cutting the grass and take out the trash, but they're saying women still do more of it than men. What are your thoughts on that?
From what I've seen, like in my family in particular, like the man he takes out the garbage, he cuts the grass, but like the mother she cleans and all of that.
Right. So yeah, even though it's gotten better, it's still not like exactly equal. My wife says she does like cutting the grass, but I usually take that on, and I usually take anything outdoors. I do try to help with dishes. Definitely do. I do all my own laundry. I vacuum. I don't sweep as much. There's stuff with like the electric, but I could see where it's still only 1/3. But it says of what their full-time working wives do. So in that case, hello, how are you? She's not working full-time. She's a student in my case. So I feel like, were you doing your presentation today? Is that part of the deal?
Yeah.
Okay, cool. That's what I thought. So I was going to finish up on these slides, and then you can either log in here or however, if you have a thumb drive for it, or however you want to do it.
I'm not email this week.
Oh yeah, you could do it. You could probably dump it in Schoology. Is that?
Send it to you on Schoology?
You could send it on Schoology. That way, I could open up. Yeah, this last slide. Actually, I may get into this more on Friday. But we have an extended period of adolescence. And the reason they say that's happening because the cost of living is higher. So rent and utilities are now 50%. And 30 years ago, which is kind of when I was starting to earn my own money and pay for things, rent and utilities used to only be 25% of your earnings. So you still had a lot of income. Now, rent is 50%, and I feel like we see that now as my mortgage is $1,000 a month. I think my take home from here is about $2,300. Gas, electric's like $100, and water's like $100. So yeah, I pay like $1,200 or $1,300 of my $2,300 goes to the rent utilities. It's more than 50%. And then the car payments also are the other 300 and 490. So it's almost like that's most of my income. So I have to pick up extra work where I can. So you live at home longer. That's kind of the why they say there's an extended period of adolescence till you're like 25, 29, and even into your 30s. Also, divorce is now 50% of marriage, higher the second time. It says why we no longer have same economic constraints and less stigma. Like a woman can be self-supporting and a man could be self-supporting. You also get what's called the 7-year itch. So that's like when you are married for 7 years, if you're not doing marriage improvement, you can itch to get out of the marriage. And then the 1 to 2 years of stress, anger, and depression after divorce is a common thing to experience. It says sometimes a partner will have a need to redefine their identity in terms of relations to partner. And then one last slide it has the sexually transmitted diseases. So, a serious social problem for adolescents and young adults still is sexually transmitted diseases. So, making sure that there's safety with and knowledge about the possible STDs. Because a big one is still like the herpes virus and whatnot, and that can be transmitted very easily. Uh, Maybe here is a good stopping point, and then next month, we are in the last month of school, about alcohol and drugs and highest use in college students. It's also a predictor of marital and domestic violence, injury, healthcare experiences, the risk to a fetus, and a parenting role, and then cognitive behavioral programs. They'll challenge the glamorous effect of alcohol and then challenge the safety while drinking. Let's see. Any questions about all those? We're interviewing a new candidate today for the social work director. So Dr. Allen may have one here in a minute. My left eye does not want to work today. There's like either dust or a hair. All right, let's open the Schoology. So yes, if you guys, are you also going to write your final paper on the same thing? Like do your presentation on eating disorders and write your paper on it?
I think so.
Okay, that's fine. You can do either the one that is there in the syllabus or the same thing that you presented. And so I'm okay to either. Some people like having that option of what you just researched is the same. All right, let's take a break, and then whenever you're ready, you send it. I'm going to just use the restroom. I finally got off my crutches. Okay. Is it working for you?
I cannot think of it on my
Did you? Oh crap.
because it was supposed to. Yeah, because yesterday I was doing my PowerPoint and my paper, and I think instead of me, I was moving too fast. So I know I downloaded my paper.
Okay.
I accidentally deleted it.
Do you want to present it off of your paper?
Huh?
Do you want to just present it off your paper?
Oh no, because my paper was for another.
Okay.
I remember what was on the presentation.
Okay. Or do you want to just go for Friday or whatever?
Yeah.
Okay. We can do that. Let's see here. So yeah, today we are interviewing a new director in the social work program. And that's kind of a big deal because we are in the middle of reaccreditation. So staying accredited, if you guys are considering graduate school, that's a big deal. It saves you a whole year of graduate school. So in the fall, he would be in charge of that, or she, whoever we hire. I feel like there's a candidate, at least two, and then we'll have a candidate position for professors because Dr. Allen says she will be retired. Do you guys have Dr. Allen as a advisor?
Mm-hmm.
Both of you?
I have for a class too.
Oh, that's right. Okay. Do you know Dr. Allen? Or who's your advisor? Okay.
So is Dr. Allen the only social work advisor?
It would be me, Dr. Allen, and then we have two sociology professors who also advise. So Genevieve, and then you do have Genevieve? She's pretty good, actually. Did she already get you registered? Okay, good. Because you guys, will you both graduate at the same time?
What year? No, I'm 23.
Okay, so you're like kind of a sophomore,
I am sophomore.
and then you're a freshman? Okay. I wonder how they got you in this class your freshman year. That's impressive. But Genevieve wasn't your advisor until this semester, right? Is that okay? Because I feel like usually you'll take it. So you've already taken intro, and there's a few others, and then have you done all of your core curriculum like English and math and writing? Okay. Did you bring any credits in with you?
Like coming in?
Some people bring in like AP stuff, but I never do that. Or transfer credits. So, well, cool. Our last slide on this chapter. Well, we had the other two. So, one is they cover this especially at the end of college, and this could be as early as high school and as late as adulthood. So, rape trauma syndrome is known as a cluster of symptoms experienced by sexual assault survivors. Common feelings associated with rape include depression, anger and guilt, and shame and anxiety. The three phases, there's first the disorganization phase, so feelings are more likely fright, anger, and then disbelief. The second one is controlled reaction, a more composed and calm perspective following the trauma. However, the trauma is still very real. And then finally, the reorganization phase is adjustment and adaptation necessary following the rape to gain equilibrium in physical, psychological, social, and sexual areas. So this may be something they go through across the street at the counseling center because it is very real, along with domestic violence. So domestic violence in the family, 1 out of 3 women experience at least one physical assault by a partner during adulthood. And it could also come as verbal assault. So screaming, yelling, like controlling behaviors. So be on the lookout and aware of that. Women are more likely to be killed by a husband or ex-husband, boyfriend or acquaintance than by a stranger. So more often it is someone that you know. So again, keeping up the warning signs and looking up. And often it can happen while there's intoxication. So on this last slide, we can open up for discussion for the last 12 or 15 minutes about alcohol and drugs use is the highest in college students. So one predictor of marital and domestic violence, injury and healthcare expense, even risk to fetus and parenting and crime is a alcoholism or substance use disorder, and then also cognitive behavioral programs. These are often the recovery centers. I worked at Claremont Recovery Center. Hopefully they do something like they'll challenge the glamorous effect of alcohol, challenge safety while drinking, and provide alternatives to drinking. So anything you guys want to talk about in that realm, like I'm sure we're not a dry campus, right? You guys are allowed to drink here, I think, if you're 21 or whatever. Like some campuses don't even let you buy alcohol.
I know, but on this campus, people don't be 21 drinking.
Right.
So I think on that slide, everything that was said is true because people who drink and some people on campus don't just smoke weed, they do more. So they act different. Like everybody don't know how to handle their alcohol.
Right, and
that
they
does cause them to get violent.
Yes.
Or if they're not the violent type, then it makes them more sexual.
Right. Yeah. Well, it kind of takes away those barriers, like your normal thought in your brain that's like, hey, you shouldn't do that in public. Like you can flirt with a woman and have a mutual, or a man and mutual whatever it is, and then move forward. But then when you're drunk, you're like, no, I'm just doing what I want. And so that's the danger that comes with it. Any thoughts from you? As a freshman, are you in the dorms? And it may be different in the pandemic too. I don't know. Like since we've had pandemic.
No, it's about
Is
the
it?
same. It's the same.
Were you a senior in high school last year then too?
Mhm.
Which they say most, I think that was our previous. So we were early adulthood or adolescence, and now we're in adulthood. And they're saying, like 2/3 drink in high school and try drinking or smoking. And then by college, it's similar. It's those who may have a predisposition to addiction in the family, as it can be genetic. It could be several things. That's where you need to be careful. If you have like a few and you're like, yeah, I could have 12 more of those. That's when it could be a problem. And then some people drink and they get dizzy and they're like, I don't know if I want to do too much more than that. Or some drink to blackout, there's blackout drinkers. So that's some of the stuff that comes up. Definitely don't drive if you're drinking, I'm not here to tell anyone I don't know even how our campus handles it. Like the cops, I've seen drug dogs before, but only once or twice. So I don't know how harsh they are at finding booze even, or people drinking or smoking if they're tough, I try to keep it as an open discussion in here as a counselor and social worker myself, like knowing that you all will be exposed to it and just learn how to be responsible, so to speak, Get the work and homework done, and those two of our 4 major assignments are due, in the next month. So like this week with the presentations and next week, and then the final papers kind of like April 30th. So that way you guys can have all of May for your final in other classes. So I also uploaded things into Schoology for you that could help you guys with licensure. So like licensure practice. That was weird. It's trying to get me to save it.
Yeah, I was going to add that the alcohol and drug use is higher in college just because in high school, students aren't allowed to do it how they want to. They got their parent over there, so don't do this, don't do that. So it's like when they go to college, it's like, oh, I'm buck wild, I'm free. I don't have no parent on my shoulder, so I can do what I want to.
Right. Yeah, and it is crazy to see some of the challenges that can come with that because Yeah, it's real easy to, like, you have to keep a 2.0 to stay off probation. So it's real easy to forget classes for even just a few months when drinking and then get quickly on probation. Um, so yeah, those of you that are filming your um, presentation on a major mental health disorder, you would just put it into that discussion area so that everybody can see it. So filming you doing the PowerPoint, the video of you doing that. And then here's the large final paper instructions that are in the syllabus. And oh geez, we're already up to the last few weeks, which is, it just moves so fast. So try to get you guys up to licensure. Oh yeah, the licensure stuff is actually in the folders. So if you go into your folders and you want to download some of that licensure stuff, it's right here. And it's what we created for our students over at Northern Kentucky University to pass the licensure exam. This kind of does your whole chapter together in human behavior in the social environment. So this one is more of 75 slides, but it covers everything you ever had to learn in hbse. So if there's theories that you're going to use in your final paper, because it does ask you to include a theory, the first several slides are on, that's the first theory we got. It was called the person environment ecosystems theory. And in this theory, it includes why do individuals behave the way they do, and the widely accepted that our behaviors are the result of nature and nurture. This is why us as social workers consider micro, macro, and meso entities when working with clients. So we'll ask them about their family, we'll do the genogram, we'll do their eco map, then we even get into the genetics and the biology, like are you predisposed to alcoholism, any mental illness in the family. Then assess their community, like if they're having job problems, are there jobs available? And also goes into here that individuals are influenced not just by our own internal workings, but by everything that surrounds us. So it could be biological, psychological, and sociological. Theories in each of these areas will be discussed next. So this one is the biological development. We already kind of cruised through your developmental milestones at 4 months. Baby motor can balance head and lift, watch their own hands, and place objects in mouth. So these are all on your social work licensure exam. So make sure to download this stuff if you want to pass the licensure. Some people don't want to get a license, but if you're going to get your master's, it helps. You'll get paid way more with a license and way more with a master's. Social, recognize familiar faces. They reach, smile, laugh, squirm. Their language is like usually babbling. At 8 months, and this is kind of where my baby is right now, so I'm going to take a picture of that. It says with motor, they can sit alone, they can pull themselves into standing position. She actually does kind of do that. She can pick up objects and start to crawl. With play, they'll bang toys together. They like drums. They can pass objects from one hand to another. And these are all good things. You can study these like flashcards for your review for the exam, because this is everything in hbse that's on the exam. Adaptive, they can feed themselves pieces of crackers. They can munch. Sometimes they are munching with the gums because she only has like 2 teeth. Social, they imitate facial expressions. They can play peekaboo, patty cake, and wave bye-bye. Language, complex babbling, maybe saying words such as mama and dada, but don't understand the meaning of the words. Actually, I feel like she does kind of do that. Motor, this is at 1 year, so they can like crawl. I guess is what's coming up. We're having another baby in a month. They can crawl and walk with support. They can stand alone, play, likes to examine toys, drops and picks up toys, touches and pokes toys. Adaptive due to exploratory nature at this age. Houses need to be baby proofed. So that's kind of where we're at. Social, they enjoy having an audience. Language, they can understand simple commands, expresses choices, likes, and can imitate sounds and a few words. Then they get to 18 months where they can walk and crawl. And then, so as you study this, you guys take the licensure test as early as your senior year. So when you're a senior, you can get licensed and get a job that pays well even during your master's. It goes through all the developmental milestones. After that, it covers some of the biological brain development, sexual activity, menopause, then psychological development, personality development. Here's another theory you could use in your final paper. Freud. People are born with particular traits. There was also the ego defense mechanisms in Freud. Then there's personality, and these would be phenomenological theories. You could use feminist theory in your paper. You could use cognitive development theory in your paper. So making sure to cover one of these theories. Even the Lev Vygotsky's theory or emotional development. So like attachments, which there's 2 slides from Dr. Bowlby and Mary Ainsworth. And yeah, the different type of attachments that can be formed. And by then you're already halfway through this whole entire review that gets you ready for passing the licensure exam. Self-concept, there's Harder's theory. They even have some intelligence stuff. Erik Erikson's theory, which are the different stages of development. We're actually right about here on the end with young adulthood. So intimacy versus isolation, where you're all meeting partners in college possibly. After that, you'll get into generativity versus stagnation, and that's in adulthood and maturity. And then the last one is ego integrity versus despair. We'll finish that in the next 2 weeks. Reflecting and accepting your life, and then parenting and creating after the love relationship. You could cover the 8 stages of development that we just went through. Also, the 5-phase racial and cultural identity development model, like the conformity, dissonance, resistance, and introspection. If you want to use Kohlberg's theory of moral development, you can have that, or Gilligan's alternative to moral development. So these are all the different theories you can use in your final paper. There's a lot of theories in HBSE, and Dr. Allen covers a lot of these in the second half when you do HBSE 2. Have either one of you taken HBSE 2 yet? You'll have more theory then. Sometimes they let you take them in reverse order. HBSE 2. So it's human behavior in the social environment. This is part 1. Dr. Allen does the part 2, which is getting more into theory. So anyway, make sure to download that before you lose access to my slides. One of her favorites is Maslow's hierarchy of needs, because it's saying you have to have those basics met before anything: safety and physiological needs, food, water, and shelter. So that's all I have for today. Any questions?
Oh, I did.
Yeah.
So on the discussion that's do on Saturday,
Mm-hmm.
are we talking about the video or is there like the type of questions?
Oh, yeah, just to review the material and stuff that they have for them to use during the pandemic.
So we're talking about the video.
Yeah, so child development, it's due on April 10th, you're saying. So, review material, I'll put a question in. All material and answer what stood out to you the most and what you'd use. What you'll use as a social worker. So, sorry, I didn't know there wasn't a video in there. So it's a lot of material, but where do you find the videos? That's actually what I was looking for.
Oh, that's you added?
It's due on April 10th, right? In 3 days.
Mm-hmm.
So it's called The Incredible Years Resources. I just didn't see where the video was in here. Like, I just put a link to the website. Were you able to find the video?
Oh no, I had assumed it was a video.
Oh, okay. It's all materials like that people are using for resources for group leaders working remotely. So different stuff for, developmental things with kids and how to do it with parents and COVID-19. And then, so a lot of things that you can download and even use in your practicum or practice. But you're right, there may be a video also, and that might be your favorite thing, which would be okay. Or the first thing that you pick could be your favorite thing. Any other questions? If you guys get a chance, meet these candidates we're having, because they will be your fate in the social work program. The director will make all of them rules. And look forward to seeing your all's presentations and final papers. And that's all I have. Oh yeah, there is some videos. So like experts in action, child program video samples. So for like therapy and stuff. So there are videos if that's what you prefer over the reading stuff. It might be that you have access easier to the documents. But it's all about like doing social work in the pandemic. Whew. It's getting hot out there too, isn't it?
Yes.
Ready to be done, you say?
It's 79 degrees outside.
Is it really? Dang. I gotta look that up because I dressed for like the morning and